Colon disease is an impressive enemy, quietly prowling inside the profundities of our bodies, frequently inconspicuous until it's past the point of no return. This treacherous illness, described by the uncontrolled development of threatening cells in the colon or rectum, can strike anybody paying little heed to mature orientation or race. In this video, we will dig into the universe of colon malignant growth, revealing insight into the 8 basic side effects that often never be overlooked. These side effects act as the body's approach to conveying trouble messages, asking us to make a move and look for clinical consideration. Previously, it's past the point of no return. Colon malignant growth is a common and possibly perilous condition. As per the American Disease Society, it is the 3rd most ordinarily analyzed malignant growth in all kinds of people in the U.S., and it's liable for a significant number of disease-related passing. So overall, however, there is trust in the fight against this imposing enemy. Early discovery through the acknowledgement of side effects can improve things greatly. In the Gessen therapy of colon disease, the vitalities in mindfulness, cautiousness, and opportune activity so should set out on this excursion together, investigating the 8 basic colon disease side effects exhaustively toward the finish of this video. You'll be exceptional with information that might actually save your life, or the existence of a friend or family member. Recollect the way to prevailing over this infection is to never disregard the admonition signs. Number 1, blood in stool. When blood seems shup in your stool, very well may be blood in stool because eophascopy of elements, for example, hemorrhoids, butt-centric fissures, or gastrointestinal draining from different sources. Hemorrhoids, enlarged veins in the rectum, or bacteria, typical reason for rectal draining, comparably butt-centric. Fissures, little levels in the covering of the rear end, likewise bring about blood in the stool. These circumstances, while concerning, are for the most part not related with colon malignant growth. On the other hand, gastrointestinal draining can be beginning in 8 from various pieces of the stomach-related framework, counting the stomach small, digestive system, and colon. This draining might be because of ulcers, diverticulosis, or on the other hand, even colorectal disease. The vital angle is to separate between these causes and perceive when to look for clinical consideration. The kind of blood in your stool can give important insights. Splendid red blood in the stool frequently proposes draining close to the rectum or butt, for example, from hemorrhoids. Or on the other hand, butt-centric fissures, in contrast, dull tear or dark stool, might show draining further up in the gastrointestinal system, conceivably from the colon or stomach. It means a lot to take note of that blood in the stool would be able, some of the time, show up as streaks or be blended in with the stool, making it less prominent. Number 2, stomach agony or inconveniences to mock torment or distress. Understanding the idea of the aggravation and its area can give important insights to mock torment because of colon malignant growth is frequently depicted as crampy, irregular, or on the other hand constant. It tends to be situated in the lower midsection and may in some cases be related with swelling. It's vital to take note of that stomach torment is a vague side effect, which would not joke about. This can happen in different circumstances other than colon malignant growth. Gastrointestinal issues, for example, touchy bowel condition, IBS, diverticulitis, or gastritis, can likewise prompt stomach uneasiness now and again. Stomach torment related with colon malignant growth might be joined by different side effects. For example, makes progress within striking propensities, unexplained weight reduction, or blood in the stool. These blends of side effects can be particularly unsettling and ought to incite prompt clinical consideration. Number, unexplained weight reduction. 3. Unexplained weight reduction. Understanding that huge weight reduction is fundamental without irreasonable clarification is certainly not a typical event. By and large, medical care professionals consider weight reduction of over 5% of one's body weight over a range of 6 to a year to be unexplained. While there can be different explanations behind unexplained weight reduction, it's indispensable to consider the chance of a hidden medical problem, particularly when joined with different side effects. Colon disease can prompt to unexplained weight reduction in light of multiple factors. First, the growth can impede it their tin of supplements in the colon, prompting healthful acts. Also, the body's resistant reaction to the malignant growth can increment digestion, making an individual consume more calories than normal. Number 4, fat. Weakness related with colon malignant growth is in many cases something beyond feeling fatigued, tired. It tends to be outrageous depletion that disrupts your day-to-day exercises and personal satisfaction. This variant be joined by shortcoming and an absence of energy. The association between colon disease and exhaustion lies in the likely improvement of frailty, a condition portrayed by a decreased number of red platelets or a low centralization of hemoglobin in the blood. Weakness can result from colon disease when the growth causes draining. in the gastrointestinal parcel, prompting lack of iron and a lessening in red platelets. The outcome is a diminished capacity of the blood to convey oxygen, which can prompt weariness. Number 5. Pallor. Weakness is a condition where your blood anemia needs sufficient sound red platelets to convey a satisfactory stockpile of oxygen to the body's tissues. It can result from different causes, including wholesome inadequacies, ongoing sicknesses, and draining issues. One of the expected reasons for pallor, particularly with regards to colon malignant growth, is gastrointestinal draining colon disease can prompt sickliness when the growth causes dying in the gastrointestinal parcel. This draining, frequently inconspicuous, can progressively result in a huge loss of blood, prompting a lessening in red platelets and diminished ability to ship oxygen. The result is frailty. The side effects of pallor can change, however, frequently incorporate weariness, fair skin, brevity of breath, and cold hands, and feed it. It's fundamental to perceive that while sicklings can be a side effect of colon malignant growth, it can, like be brought about by other medical problems, like healthful acts or constant sicknesses. Number 6. Rectal draining. Rectal draining explicitly alludes to the presence of rectal dying blood that comes from the rectum or rear end. It very well might be observable on tissues subsequent to cleaning or in the latrine bowl. The shade of the blood can go from dazzling red to dim red, relying upon its source and the time it spends in the gastrointestinal system. Rectal draining can be related with different circumstances, counting hemorrhoid-centric gaps or gastrointestinal draining, Ham's enlarged veins in the rectum, or on the other hand, typical. Reason for rectal draining, particularly when the blood is dazzling red, comparably butt-centric gaps, little levels in the coating of the rear end can bring about rectal draining anyway. While rectal draining is relentless, serious, or related with other concerning side effects, it ought to raise a warning. It very well may be an indication of a fundamental issue, including colon disease. Colon disease can cause rectal draining when the growth seeps into the colon rectum. This draining can bring about dim or dark stools, as has the opportunity to blending with H-stool and DASIC goes through the gastrointestinal system. In such cases, rectal draining can be a late-stage side effect of colon disease. Number constipation, even blockage clogging, is a typical stomach-related problem that the vast majority experiences sooner or later in their lives. It's portrayed by rare ball development, strubble, passing stool, or on the other hand, hard dry stools. Generally speaking, stoppage is a brief issue that can be settled with dietary and way of life changes. However, when blockage becomes persistent and is went with by other concerni, side effects, it ought not be disregarded. Persistent blockage is characterized as shaving less than 3 ball developments each week, and encountering these side effects for a drawn-out period. Colon malignant growth can make persistent obstruction due to the cancer's presence in the colon, which can hinder the ordinary progression of stool. Accordingly, you might encounter trouble passing stool. Furthermore, diminishing in the recurrence of ball developments, it's critical to recognize periodic obstruction and persistent blockage. Infrequent stoppage can result from dietary decisions, stressor, other brief. Number 8. The runs. While blockage can concern diarrhea side effect, the contrary, the runs is similarly essential to consider, particularly when it is tenacious and unexplained. The runs is described by incessant free and watery stools, and it can have different causes, including contaminations, dietary decisions, or hidden medical issue. Colon malignant growth can lead to constant the runs when the growth impedes the typical section of stool through the colon. In such cases, the body might answer by expanding the recurrence and detachment of stools coming about in loose bowels. It's vital to perceive that persistent the runs sought not be overlooked, as it prompt drying out, and dietary lax. Ongoing looseness of the bowels can be debilitating and fundamentally influence your personal satisfaction. Thank you for watching our video. Your health matters, so stay informed, stay vigilant, and seek medical help if needed. Don't forget to like, subscribe, and hit the notification bell for more valuable health content.